please allow me to introduce my illustrious panelists. If I can ask them all to take to the stage and sit under their names. Dr. Amna Al-Falahi, who is a clinical psychologist, Danat El Emirat Hospital. Please do come on stage and please give her a big, big warm round of applause. So Dr. Amna, I may ask you to sit just next to me. Thank you so much. Dr. Samia Zahar, who's a medical director, Danat El Emirat Hospital, fantastic. And Kiran Jalani, the consultant at OAG at Danat El Emirat Hospital. Ladies and gentlemen, please do give them a big, big round of applause. Thank you. And anybody else who wants to take some seats, we've got loads of seats here in the front. Please don't be shy. Do come forward and speak and sit with us. Ladies, thank you so much for joining me. As I outlined to our audience there, this is a very topical area, and there's a lot that's been said about it outside the region, I feel, and perhaps we could benefit from hearing more within the region. Kiran, do you have a microphone? You do, fantastic. Just make sure everybody. So let's just have a very quick answer from all of you about the importance of putting the spotlight on maternal mental health. Why do you think this is a subject matter we should be discussing here today?
First of all, it's very important to address that mothers during the pregnancy and after the birth of the child can go through a lot. And this period can be very vulnerable for a lot of mothers. So neglecting that and not taking the right steps can put them in danger. 20% of women who diagnose with postpartum depression, they do commit suicide. So it is a medical urgency. We need to talk about it. We need to shed light on it and break the stigma, because but what we do every day with our patients, it's not like physical things are stopping them from coming and talking to us. More it is a stigma which is stopping them from opening up to psychologists. So therefore, I think it's a very, very important topic to talk about and discuss.
Thank you very much for underlining that point there. Kiran, if I can bring you in there. Stigma and taboos very much at the forefront when we think about this subject matter.
I think when you listen to the lived stories of the patients who come to clinic, and I'm very open to them because I was one of those patients who had postnatal depression when I had my baby. And it is a subject that needs to be opened up because it does take lives. If you look at the confidential inquiry that came out back in 2013 onwards, it has become the direct cause of maternal mortality and leading cause of maternal mortality in the first world.
This is already started you off with a lot of anxieties. Your job might be changing. You might be afraid to tell your employer that you're pregnant. So there are a huge amount of changes, physical, social, and emotional, that happen in pregnancy that impact on mental health.
And you know what, Dr. Samaya, just hearing you talk about this today, it actually dispels some of the myths. Because even just being able to be so candid in society, and I'm talking about all societies, that these are uncontrollable changes with a very otherwise positive and exciting chapter in a woman's life, in a family's life. But being able to hear you detail them, it kind of makes sense that this should be a period of time which one is under a little bit more scrutiny, mentally, physically, emotionally. So thank you so much for explaining that. You said a key word there. You said hormonal. Now, Dr. Amna, when you all took the time out earlier ahead of Arab Health, and we had a lovely virtual briefing ahead of today, we do our homework, people. You mentioned that maybe emphasizing on the hormonal changes might be a way to tackle some of the taboos and stigma. It might be an easy way in to then open conversations further. Could you expand on that?
Yeah. Before going to the point of a stigma, I would add to with the hormonal changes. What basically happens when we look at the emotional changes.
Sorry, Dr. Amna, keep the microphone.
Yeah,
Yes.
sorry about that. Women sometimes don't understand that while they are pregnant, these hormonal changes can change the neurotransmitters in their brain. So I often get mothers after the delivery, like a very second or third week of delivery, asking, "Doctor, I want to leave my husband," for example. They don't know. They just know that things are not okay. They know that they are fighting a lot. Their partners are not listening them or stuff like that. But the core things happening inside them is something to do with their brain. The brain, when the neurotransmitters changes in their brain, the way they think changes. Is no longer, if I can take, like if I'm going to do my chores normally every day, that particular day, I'm not okay to do the same thing. And sometimes they don't know what's happening to them, and they don't know like why they are acting that way. So you see the blame on the very near circle, like my husband or my first child or my mother-in-laws, whoever are living with them, they will be judged. Oh, it's because of you, I'm behaving this way. But in reality, what's happening is that because there's something changing in their body, so these are the reactions we see from mothers, especially right after the delivery. We say, let's give it 2 weeks. We all know the baby blues. We all know that like the depression we live after the the first 2 weeks. But if this feeling not okay is going on for more than 2 weeks, it's very persistent. Here is something alarming. I need to do something about it. Now, what happens most of the time when they feel that they cannot take it anymore, a lot of mothers will suffer silently. That's why we call maternal mental health is a hidden burden. We see people, as Dr. Sumaya said, with the high blood pressure or with the increased heartbeats. These are the physical symptoms. They come to the clinic to take, urgent, care or whatever. But in reality, the maternal mental health disorders, sometimes they don't know what's going on with them. So that's why, we need to be very careful. It's a hidden burden. We need to know why this is happening with these mothers, and also screening. Screening is very important. Now, coming back to the stigma, a lot of the stigma we learn from our parents, and our parents learned it from their parents. So it's a generational, thingy going on and on until someone breaks this stigma. I remember when I got my first child, I've been told mother equal sacrifices. In Arabic we say الأم تساوي التضحية. And that is a very, very big statement. You go anything below that, you are not a good mother. A lot of people judge you. Come on, she cannot take that. God created you as a woman. You need to take that. You need to handle it. You need to suffer in silence. So a lot of stigma I see with my patients is due to what they learned from their own parents. So, easy said than done. Breaking this stigma is not easy. Sometimes it takes, let's say, a month or two talking. We do a lot of CBT. But in reality, some women feel like, no, this is not okay. And like when they come with their husbands, they feel like, she's okay. It's just, 2-3 days and she'll be fine. So, breaking a stigma will take time. We need to talk to them more often about it. We need to highlight that whatever is happening, exactly as I said, if it is more than 2 weeks and it's going on and on, we need to highlight what's going on in our case. So.
Well, thank you so much for giving us that insight and setting the scene for us there. You mentioned there it's a hidden burden. It's a really powerful and actually quite damning, it's a damning label, isn't it?
Absolutely.
Kieran, right at the offset, you kindly shared your personal experience there. Would you mind giving us an insight that you feel comfortable to share with us today, and how you find that sharing your personal story and hearing from others speak openly about this really is possibly the key to making the profound change we need?
When we do forums and discussions and conferences abroad, we always invite women to come with their lived stories. The reason being is that person, that individual who's lived that tale, is the best person to teach us and educate us, the way we talk to them, the way they the way we made them feel vulnerable or they're not complete is just so important for us as healthcare providers. So for my story, I actually used my stories when I went to the commissioning agents to talk about increasing the funding for mental health services in our hospital in the UK. So I had 4 pictures on the PowerPoint, and I said, which one is the odd one out? All 4 of them were women with small babies. One of them was me, and I was the only one who was alive. All 3 of them had committed suicide. When you make a powerful statement, this is the way you have to make impact, because it does cause women their lives. Now, my cause of depression and anxiety was isolation, and I could not breastfeed. So this sort of stress that was put on me by myself, the ruminating thoughts, the intrusive thoughts, took me to the point of standing at a marina and thinking, what would happen if I jump off this marina right now? What part of me is going to die first? And that was the wake-up call when I started to get access for care and get the help that I needed. And I'm proud of it. I'm proud to talk about it.
Thank you so much. Thank you.
I tell my patients about it that it's nothing to be ashamed of. If you broke your arm or you cut your hand, you will go to hospital. It's the same thing. You are hurt, you're wounded, you need the healing.
Thank you so much. A round of applause to Kieran for being so open and sharing with us. You really moved everybody today. And I think what your particular personal experience highlights, as you said there right at the end, this idea that if you had a physical injury, you would find a way to cure it, you'd find a solution. And when we think about the mental, emotional well-being aspect of lives, and this subject matter is, of course, wider than maternal chapters in mothers' lives. We are talking about mental health and the stigma and the taboos in general. But of course, to focus on the maternal mental health, what do we feel like we've outlined? There is a very clear problem. It's a global problem and a hidden problem. What do we feel like are some of the solutions? Maybe if I can bring in Dr. Samaya for this.
So I think some of the solutions we've already highlighted and illustrated some of them here today. By talking about it, by affirmation. So I think why maternal mental health is ideal. It's a little microcosm of, like you said, mental health is a global problem. It's not specific to women, but obstetricians or healthcare providers in pregnancy have a fantastic opportunity to follow a woman through a journey for 9 months. So you will have plenty of opportunities to touch base, see a woman at different opportunities, gain her trust, develop that rapport with that patient. So it's an opportunity to gain that trust and allow someone to open up to you. And this is what it's about. It's that affirmation and allowing them the acknowledgement that I hear you. It is normal. It is normal for you not to be okay that your body suddenly doubled in size. It is okay for you not to feel okay about potentially losing your job. This is a normal anxiety. These are normal feelings. And like we said, it's very important. If someone, so Amna alluded to the biochemical changes that happen. So you're okay if you've got a vitamin deficiency to have a supplement of vitamins. So it is okay to have antidepressants. We have to allow women to feel that this is okay. And because there's a lot of stigma, there's a lot of cultural weight around taking antidepressants, that, you know, either your faith is not strong enough or you're not a very good mother because you couldn't tolerate, you know, I sacrificed and I did this. So it is important for us to break these cycles. And this is how we start to improve it, by talking about it and the affirmation and acknowledging it.
That's such a powerful and empowering message. I'm going to bring in Dr. Amna now, because I'm really impressed with Danat El Emirat for having a clinical psychologist position, and obviously you specialize in this area. This is a solution, right? This is a solution where you fund these positions and you allow the experts to conduct your research, to have your role where you interact with the patients. Tell me a bit about the wonderful hospital you all three represent and how it's at the forefront of this.
Right. First of all, I'm very lucky to be part of Danat Al Imarat Hospital. They are very supportive. I remember I had some issues actually reaching to some patients of mine because they live far away from Abu Dhabi. They live in Al Ain. And those ladies were pregnant and they're going through a lot. So the husband brought the wife first day, but when I gave the appointment next week, he said, "Doctor, I cannot bring her because I work and I don't have transport." It was very difficult actually because we had all set up available, but it was not active. So we started telehealth. We started reaching to these women, talking to them online. Pregnancy by itself is very difficult for them to move from one room to another, but moving from one place to another, for example, from one Emirates to another Emirates can be a burden. So yes, Danat Al Imarat, they helped me a lot in putting the system in place and helping me to reach out to those ladies, to those mothers. And some of them, they delivered babies. Some of them, they are, like in their 5th month or 6th month. And this is the time where they need somebody to talk with.
So these are very recent patients.
Yes.
So we're talking within the last few months.
Yes.
These particular
Yes.
examples.
Yes. And, because we have psychiatry, we know that by screening, this is a possible postpartum depression case. So we take the necessary steps to protect these mothers from getting, postpartum psychosis. Because if you're going to leave it untreated, it gets worse. So, this is one of the things,
And the example that your hospital set, so thank you very much for that
No
insight
worry.
there, Dr. Amna. Is this really at the forefront of, for example, what the UAE in the Middle East is achieving? Are we seeing a lot more of this across the region, or are we still lacking in these types of services? We don't need to name any particular hospitals, but how do you compare to what else is out there?
telehealth, it's happening.
Yes.
Online sessions are appreciated. A lot of patients think about COVID. In COVID, that's the only thing we could do as caregivers, reaching to a lot of people who wanted help through the telehealth. So yes.
And it's accelerated that.
Yes.
The pandemic was
Yes.
a way that we necessitated this, but fortunately allowed the legacy of it, telemedicine and with
Absolutely.
digital access. Now,
Absolutely.
speaking of access, I am going to ensure that I open it up to the audience because we've got about 5-ish minutes on the clock. May I ask if anybody wants to ask a question? Please don't be shy. I can come back to you because I have many more questions. I'll give you another minute to have a think. Now, earlier, Dr. Kiran, you mentioned when we were talking about the whole idea of the importance of discussing something like this, this doesn't just affect the mother or the mother-to-be. We're talking about the whole family. Now, often we do talk about the woman in this scenario, but men, when it comes to maternal mental health, are impacted. Another hidden figure,
Yes.
another hidden burden. Could we explore this issue and how we can bring a more holistic approach to solving this?
Oh, this is a very topical subject at the minute, dad's mental health. So in all the conferences for perinatal mental health, we now get dads to come and give a lived experience detail to us as well. At the minute, what we try to do is see the family as a unit. So mom and dad come to the clinic together. Let's do the psychological, psychiatric interventions, obstetric interventions together. So you see them as a unit. I have seen some dads so traumatized because of birth trauma that they do not want to set their foot in the hospital. And for men, it's even worse because of the social pressure of being a man. You have to be strong, you need to protect your woman. And that's why it's very important. We have something on Twitter called the Dads Pads, where the dads get together and talk about their experiences with their loved ones, how they were affected. And so a lot of times when they come to clinic, I've just joined UAE. So I've seen a dad who actually talked about his mental health, and I referred him to our psychiatrist. And I was happy that I could give him that comfort space, that he could tell me about his experience. So I think it's all about acknowledgement, being able to tell them where to access care, and then having equity of care. So every care that a patient gets is equitable, no matter what their background, their gender is.
And Dr. Amna, I see that you want to come in on this point, so please do.
Yes, actually, we don't talk much about it, but even men can get depression.
During this maternal
abs-
phase in particular?
Yes.
Yes.
Because of the stress and the load they go through, could be financial barriers, could be changing emirates, or if the wife is, for example, in away from UAE and he's living somewhere else, they do go through depression. And recently, the good news is, I see a lot of men, they coming and they talking about their symptoms, depression symptoms, which I think in my professional, like in my profession, it was not very evident, like let's say 5 or 7 years ago. But now, yes, a lot of people, a lot of men coming to the clinic discussing their depressive symptoms. Like, this is what I'm going through. Is it normal? It's not normal. What shall I do? So we run a lot of CBT sessions for those men as well.
And I think this is where these types of panels are highly illuminating, because sharing this type of information
Yes.
might be something that people are unaware of.
Yes.
And having these types of services is
Absolutely.
actually quite revolutionary and, of course, necessary. May I just check that an audience member wants to ask a question, because I really don't want to leave you out. Oh, a gentleman over there. I love the fact that we have a good gender balance. May I ask a microphone to be given? Oh, fantastic, to my colleagues already thinking about this. Please do introduce yourself and let us know who you want to ask, or everybody.
Hello, ma'am. I'm Dr. Ahad Rahman. I'm oral and maxillofacial surgeon by profession. And I want to ask this question to both of the gynecologists, ma'am, sitting here. That one of the most commonest drugs that we actually, prescribe to the patient is, one is calcium and another one is folic acid, right? And later on, I'm myself a victim of this postpartum depression, and because of my, I shouldn't tell this, because of my wife, and she was also struggling. And since you mentioned that the entire family gets affected, right? So the thing is, I want to ask you. Later on, I read about this folic acid thing, that any patient who had folic acid before giving the birth, from the day the patient consulted the doctor, the patient was asked to take calcium and folic acid, right, to prevent this neural defects, right? So I read about this, that most of the cases of postpartum depression are because of the folic acid that the patient takes before delivering, right?
Okay,
Is it
so-
true or not?
Okay, so
And
that's
one question for
yes.
Dr. Amna also. Don't you think it should be made mandatory for the government, like by the government, to actually consult a psychologist in the entire phase of pregnancy? Don't you think it should be a good idea why the government should be made mandatory for all the mothers to consult a
Thank you very much for your
psychologist?
question. I see that you are a strong advocate for this type of policy to be taken. So first of all, let's talk about the folic acid. And there's a lot of information which is out there, and obviously not all of it is substantiated.
Yes, no, thank you so much, and thank you for sharing your personal story.
Yes.
It's very brave and courageous. Well done. Claps to you. So, with regards to folic acid and calcium, yes, there was a few scattered papers that came out a few years back, and they were studied in women who were suffering with epileptic or seizure disorder, where we give high doses of folic acid. So, the 400 micrograms is the dietary requirement nutritional supplement, that if your diet is good enough in green leafy vegetables, you don't have to take any extra folic acid. So really, it's not been substantiated that it causes depression or psychotropic effects. So I would be comfortable with that. I would not tell my patients not to stop taking those meds.
Thank you so much for clarifying that point, and again to emphasize, thank you for sharing and for asking the question as well. It's always good to have the gentleman's approach to this subject matter. I'm afraid we've only got a minute on the clock, but I want to give you all a last chance to speak before we wrap up. Now, let's be positive. Looking forward, what's your vision? What would be the ideal way that we improve maternal mental health? Because we've got some very important people here in the room, and we can all individually have an impact on what happens going forward. So, Kiran, if I can begin with you.
I just want to say all of you are the ambassadors. All of you should be the mental health first aid aiders. So start the screening process, ask the question. even if it's one or two questions, you have no experience in mental health at all in pregnancy, and then refer them to a psychiatrist, an obstetrician like me with special interest and experience in mental health, a psychologist for psychological interventions, and give them that comfortable space.
Fantastic.
Yeah.
Dr. Samaya?
So I would say I'm in a privileged position as the medical director to actually make a change within. So you asked earlier about what's so special about our hospital. So we're a women and children's hospital, and I would like to say we are a leader in Abu Dhabi for the care that we give to women and children. And purely because we prioritize maternal mental health, we prioritize the care of women, that we've invested in having clinical psychologists, we've invested in obstetricians who have a special interest in mental health, and having the backup of psychiatrists as well. So we are able to do such things, and I think it's about healthcare leaders being able to invest and promote such things. And as I said, it's an MDT approach that we need. So it's lots of members of the team that are required.
Fantastic. And Dr. Amna?
I think coming back to his question as well, it would be like, I'm going to answer the question through this. First of all, yes, we need to check the process and procedures we have where we work. Psychological support is available. Some of the organizations are keeping in-house psychologists, but if it is not available, the sessions can be covered with the insurance. It is important to take these sessions if you think that there is a need and there's something happening, like with your wife or whoever is pregnant or anybody who's suffering. So yes, make a list. I always say to everybody, make a list. Put the things you need, which can prepare you to be a good mother. Sometimes we don't, like for anything else, if you want to do anything in your life, you need to have a list ready, right? List of what I have and what I don't have, and try to make a bridge with things not available. Start with things you have available, and work from there. But like suffering in silence and not doing anything about it, that's not good.
I think that's a really powerful note to end on. So here today we have managed to really emphasize that this is a shocking global issue, but some of the solutions are based in acknowledging the problem head on, sharing stories, making these services accessible. So first of all, investing in them, and then having the equity of care globally and especially here in the Middle East. I'm really excited that the UAE is at the forefront, and it's super exciting to hear that everything that Danat El Emirat Hospital is doing. As you said there, Dr. Amnia, Dr. Samaya, you are a medical director, and here Danat is a role model for what can be unfolded further in the UAE and in the region as well. And on that note, let's give a round of applause to my wonderful panel and to Danat as well for really setting the scene there.